Women should not follow the United States Preventive Service Task Force recommendations because it ignores a cohort of women. What we know from the randomized controlled trials as well as observational trials is that really we can reduce the likelihood of death from breast cancer in these women as well.
Thousands of lives will be lost if we follow the U.S. Preventive Services Task Force recommendations.
There's a disconnect between what women think is a harm and what these organizations are considering as a harm. They want us to find their cancer early.
15% of my clients have some issues about screening because they heard in the news or in magazines or the CNN or the Times that there is a debate going on about screening.
There's a lot of confusion around it. They're getting mixed messages from their physician as well as from maybe even their OBGYN. I think in order for us to really combat some of the confusion around it is to educate them, educate the clinicians as well.
The data is there, it's rock solid, it's years of data, it has been proven time and time again that screening mammography starting at age 40, doing it annually, will save the most lives.
The number one thing I tell them about mammography screening is that they should have a mammogram every year beginning at age 40 because we know it works. And the data are irrefutable, regardless of what other people say, especially the naysayers who unfortunately have a different agenda. And it's not about the patient.
Speak on behalf of myself, but also of our entire group, the department and the entire institution at MD Anderson, that there is no doubt that mammographic screening saves lives.
Screening mammography starting at the age of 40 saves the most lives.
Mammography saves lives.
The number one thing that I tell my patients about mammography screening is to get screened, and to get screened at the age of 40.